What are some questions about the carnivore diet that people should be asking, but aren't? Hi, I'm Dr. Eric Westman, and welcome to my channel where I review and debunk nutritional misinformation online. Be sure to wait till the end of this video because I'll be going over some things that should be talked about, and I'll be giving you a much deeper understanding of the carnivore diet by the end of this kind of video, where I'm uncovering insights that you may not know about. Before we jump into today's video, I would like to invite you to join my free course, Start Keto Right. If you're ready to lose weight, boost your energy, and get real results, this science-backed method will help you every step of the way. No guesswork, just a proven method to help you succeed on keto faster and feel amazing. Sign up through the link in the description. Number 1, how can a carnivore diet reverse type 2 diabetes? And yes, you know, the most questions that I see on the carnivore diet have to do with side effects or some problem with the carnivore diet. No, probably the most underestimated and underappreciated effect of a carnivore diet by other people is that it reverses type 2 diabetes. Yes, well, it does that because it is a version of a low carbohydrate ketogenic diet. And the science now is solid for decades that a low carb keto diet can reverse type 2 diabetes. And when you think about it, it makes sense because food with carbohydrates get digested to sugar. Sugar raises the blood sugar. 100 years ago, a carnivore-ish diet was used to treat type 2 diabetes before there was any medication available. So it makes sense clinically, and a lot of people are pushed away by that first question about a carnivore diet. You know, is it safe? Is it healthy? No, the first question that needs to be answered is yes, it does reverse type 2 diabetes, and it makes metabolic sense as to why it does. Number 2, does a carnivore diet reverse obesity? And how can it do that? Yes, well, a carnivore diet can reverse obesity. The reason for that, you now know, is that a carnivore diet is a version of a low carbohydrate ketogenic diet. We've been studying low carb diets for the treatment of obesity for over 20 years now, 25 years at Duke University, and these studies have been done all over the world. A carnivore low carb keto diet has been known since the 1860s to be useful to help with slimming down. And in fact, Banting was a man who wrote a book, and the Banting diet was used for decades to help people reduce the weight on the body. So a carnivore diet is a type of low carbohydrate diet. The blood glucose comes down, the insulin comes down, the insulin resistance reverses, and for many people that is the root cause of the obesity. So you start losing weight, you reverse the obesity, and actually can maintain a weight if you continue on a carnivore or very low carb keto diet. So yes, you know, there's still another positive question. How can a carnivore diet fix gluten problems? How can it fix celiac disease? Yeah, so my third question that's not talked about the carnivore diet at all is, how can a carnivore diet fix gluten enteropathy or celiac? And the reason a carnivore diet can fix this problem with celiac or gluten enteropathy or a gluten problem, gluten sensitivity, is that there's no gluten in the diet. So it's a gluten-free diet. So I've had people with gluten problems go on gluten-free diets that doesn't seem to be low carb enough or carnivore enough, and they don't get the massive health benefits that totally gluten-free, carb-free kind of carnivore diet can give. I've even seen people reverse serious medical issues because I think they were dropping the gluten from their diet without really knowing it. Often the gluten is causing a problem It's hard to diagnose for many people, even in the medical world, and sometimes it takes a special procedure to diagnose gluten enteropathy. So a carnivore diet actually fixes celiac and gluten because there's no gluten in it. Carnivore is a gluten-free diet. The next question is, how can it fix sugar addiction and binge eating and all the problems from ultra-processed food that we see? Well, a carnivore diet is a sugar-free, ultra-processed free, seed oil free type of diet. So it's actually eliminating all of these different factors, and to the extent that they may be playing into some sort of medical issue for you, the carnivore diet or a low-carb keto diet that I teach is actually free of all of these irritants, if you will, these toxins or preservatives and artificial dyes and seed oils. And so you may get the benefit of all of the elimination of these other toxins from the food. And yet that is going to a carnivore diet. You don't hear about the elimination of all these other things. So I wanted to lead with the positive results for carnivore because I don't think they're really adequately addressed. It's become a sort of defensive posture, and I don't think that's really the way it has to be. Okay, what about the possible harms? Is a carnivore diet nutritionally adequate? And yes, it is, even though it may go against your common understanding or your experience or what other experts say. So actually, when you look at the micronutrients and the vitamins and minerals that we need, a carnivore diet does provide all of those nutrients that we need. This is a concept called essential nutrients. And I've noticed in the textbooks that this idea of essential nutrients has sort of been watered down, even eliminated in some new textbooks, so that you have to have a deeper understanding of nutrition before you'll say something at this level that a diet is okay because it meets all of these essential nutrient needs. But other people now are being taught, and the next question I'm sure you're asking is, but don't you need to eat fruit? Well, it's actually not an essential nutrient. You can get all of the nutrients in fruit from other foods. And I know it seems odd, and people come to me all the time saying, but I thought fruit was healthy. I thought it was good for you. And in certain circumstances, it can be, and it can be consumed by lots of people without any problems. But when you're dealing with type 2 diabetes, pre-diabetes, insulin resistance, obesity, the fruit has a high sugar content. And content of sugar in the fruits, even little fruits like berries, they still have sugar, can make a low carb or keto or carnivore diet not effective for reversing type 2 diabetes or reversing obesity or metabolic syndrome or any of these other health problems that the carnivore diet is known for, at least anecdotally, to help. No, you don't need to eat fruit. What about vegetables? Don't we need to eat vegetables? Well, again, contrary to the way I was taught, I needed to eat the vegetables on my plate as a child. We don't need to eat vegetables in general as humans. We can get all the nutrients that we need from other foods. And so the essential vitamins and minerals, the proteins and the fats, which are essential, can all be supported by a protein-based carnivore diet. The glucose in your blood and other molecules that use glucose can be made from the protein and fat that you eat. Fat to a small extent, mainly from the protein that you eat. So you're not going to be blood sugar deficient if you're not eating fruits and vegetables. And that leads to the next one is, well, doesn't carnivore diets, don't they cause scurvy? No, they don't. And this is another common misconception. You know, well, where would you get vitamin C if you didn't have fruit, if you didn't have vegetables? It turns out that meat does have some vitamin C, and when you're not eating carbohydrates, you probably don't need as much vitamin C. This is the concept of conditional essentiality, or under what condition you're eating and living, you may have a different need for a certain nutrient. And so it would be a case study if you had a scurvy from a carnivore diet, meaning it's so rare that someone would publish it as a journal article. Now, there's some situations where you might think that you're normal and you're not, and you're doing a carnivore diet. I've had people tell me who've had weight loss surgery that they get all sorts of strange nutrient problems. So if you've had weight loss surgery, that's the Roux-en-Y gastric bypass mainly, or the duodenal switch or the gastric sleeve, that's a different condition, and you'll want to be paying attention to the nutrients in a more detailed way, taking a multivitamin and other specific vitamins if you've had weight loss surgery. Again, most of the people who I see are in the clinical setting, and the common place use of weight loss surgery treatments have made it so that I'll see many people who've already had it before, and that's why I have to bring it into this kind of video. What about fiber? Well, again, fiber is sort of this thing that exists basically so that people can push the idea of fiber, and I think it has to do with regularity. Nobody wants to go too long without a bowel movement. But the studies about fiber really don't show that it produces any effect like reducing colon cancer, and so fiber is really not an essential nutrient in a human diet, even though you'll hear that kind of popular notion out there. And so I don't worry about the fiber in the patients that I treat. My standard go-to diet, which has just a little bit of vegetables and leafy greens, it's not purely carnivore, does give some fiber, but I'm not concerned if someone comes in and relaxes the intake of the vegetables and leafy greens that I would ask people to have if they can't tolerate those kinds of foods. Has there ever, been a study against low carb, and are you finding anything bad about a keto kind of diet? And there's never been a study that a low carb keto or nutritional ketosis kinds of study has been bad or harmed anybody. And I had to reflect on that because we were always in a defensive position trying to protect our data, as it were. I mean, I didn't know if Atkins diet or low carb diet was good or bad, or I saw it work in certain clinics, but we didn't know the long-term effects of it. And that's kind of where we are with the carnivore diet today. There are all of these massive health improvements. So this is why I led this video with, you can improve all of these different medical things. And I see carnivore as a subset of low carb and keto kind of diet, and you don't have to measure ketones and all that. We teach a relaxed version of what we say is the internet keto, where you measure all this and have to do macros, and you don't have to get into that mess. But so are the benefits that you see right now outweighed by any harm down in the future? We just don't know, and I don't think so, because the essential nutrients are there. The history of certain populations eating this way is there, and yet do I say, blindly follow this forever? No, of course not. So just like 25 years ago with the low carb diet, we measured outcomes. We looked at people's health over the next 20 years, and so that's what should happen today. If you are considering using a dietary lifestyle change for serious medical issues, do this with someone who understands how to get you off the medicines safely, and then understands how to teach you how to do this in a way with minimal side effects and minimal effects of getting you off the medications. But I would not worry about the long-term issues yet, because you'll be getting off all of these medicines and having such huge improvements. The short-run effect is so good that that's why it's so popular now. And it's very simple for some people to not have to worry about what to have. You just eat meat-based things. So how to do it is another sort of way that you can personalize it, and I didn't want to get that into this video, but it can be very simple. So the main questions about the carnivore diet I wanted to talk about it that are not being addressed adequately is all of the health benefits that you can get from it. And they're there. And I think it's unspoken, and there's a knee-jerk defensive position by people who are advocating for these approaches. But I think that's only because the natural tendency for people to go in this direction, if they try it with all of these health benefits, the benefits are so huge. What's missing, the science that's needed, is what happens if you take 100 people and you ask them to do a carnivore diet, and what happens to all 100 people. Right now we see the people who have the benefits, right? Is it possible that there's some harm being done and we miss it? Yeah, that's always possible. When I first met Dr. Atkins, I met the staff and all, but it was a referral kind of clinic. I knew that it wasn't going to be the general public kind of situation once I was there and I saw it in action. But I think the denominator of, what happens to 100 people over 6 months that who follow it, and not everyone will follow it, I think that information will come hopefully very soon as more research is being done in the low carb, carnivore, fasting, this kind of area. It has such huge benefit. What you eat really does matter, and we weren't really taught that as a society. In fact, we were kind of taught you had to have certain things in a certain way, and that's just not the right way to learn the basics of nutrition, which is you need protein. We're made of protein. You can run your body on sugar or fat. It's really your choice. I hope you find this helpful. If you do like this, please like, subscribe, and ring the notification bell, and look for new content on Wednesdays and Fridays. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.